This conference will now be recorded.
Hey, everybody, welcome back. It's 1 o'clock. It's time for our Monday through Thursday podcast at 1 o'clock. My name is Dr. Doug Smith. Alex is behind the camera running everything behind the scenes. We're very grateful to Alex. So when you people reach out and say thank you, please also words of appreciation for Alex. We wouldn't be here if it wasn't for Alex and other people also, Susie and others. So we always want to say thank you to the people who make this happen. If you haven't liked and subscribed us, please do. And post these podcasts on your social media and everybody else's social media. Get this word out there, because what we're doing here is the science. This is the science. If I give you my opinion, I'll tell you, hey, this is my opinion. But other than that, what we're mainly doing here is we're presenting the science. And as you may know, we're going through the entire citizens petition. We take a little bit every day, and go through it. We've spent the past couple of days going through words about what an amazing thing that happened with the U.S. life expectancy. Amazingly, U.S. life expectancy had been falling for decades, falling. All of a sudden, during the opioid crisis, U.S. life expectancy fell. Okay, and when I say U.S. life expectancy had been falling, death rate had been falling. U.S. life expectancy had been going up, and then all of a sudden, during the opioid crisis, you see a fall in the U.S. life expectancy. And then all of a sudden this year, you see U.S. life expectancy going back towards normal, and everybody's all happy. Everybody's celebrating that. Everybody thinks, oh, that's just due to the COVID. No, that's what happens when 3 million people caught up in the opioid crisis die from adrenaline toxicity, what's called catecholamine toxicity. Their own bodies killed them. And that's the science that we're presenting here in these podcasts. And on your screen right there is a stunningly important quote, okay? And it's in the citizens petition. This is a stunningly important quote. This is from a researcher up at McGill University up in Canada, Dr. Moshe Szyf. Brilliant man, absolutely brilliant. Please reach out to him and tell him thank you, because this is from the year 2011. Okay, this is 14 years old, and I want you to listen to this quote. I will read you the quote. Dr. Moshe Szyf. The realization that long-range damage could be caused without changing the DNA sequence has important implications on the way we assess the safety of chemicals, drugs, and food, and broadens the scope of definition of toxic agents. Ladies and gentlemen, that is exactly what this podcast is about. That was 2011. That was 14 years ago. And Moshe Szyf, Dr. Moshe Szyf, nailed the opioid crisis. Now, what he's talking about here, and you can see it right there in the title of his article. Okay, look at the title. Those are huge words, but I want you to see the word methylation. Okay, and I want you to see the first 5 words. The implications of DNA methylation. The implications of DNA methylation. What are the implications of DNA methylation? Well, that's what he's talking about here. The implications of DNA methylation for toxicology. Toxicology is the study of poisonings. Okay, you call poison control, you talk to a toxicologist. Toxicology is the study of poisoning. He is studying poisonings here. Specifically, he's studying DNA poisoning. And what he's saying here is, hey, you can really mess things up without changing the sequence of the DNA. Changing the sequence of the DNA is what are called genetic mutations. And if you recall, that's one of the 2 things that the FDA did require the pharmaceutical companies to check for. The pharmaceutical companies were required to check for genetic mutations and also chromosomal abnormalities. But for reasons that make absolutely no sense, I guess that's my opinion, for reasons that make absolutely no sense to me, to me at least, the FDA did not require the pharmaceutical companies check for methylation, which is what the opioids cause. You don't think so? Look at the 5 articles that are listed right there on the screen in front of you. Those 5 articles being Nielsen, Shorbov, Walkman, and Sandoval-Sierra. Okay, those 5 articles describe the methylation from the opioids. It's not even a debate. It's right there in front of you. Again, this is the podcast where you will see the science. Those 5 articles right there on the screen in front of you, read it. Okay, Nielsen, Shorbov, Walkman, Sandoval-Sierra. Nielsen, 2009, Shorbov, 2011, Walkman in 2014, Walkman in 2018, and then Sandoval-Sierra in 2020. Those 5 researchers all five of them identified the methylation by the opioids, mainly in the promoter region of the OPRM1 gene. Okay, now Moshe Szyf that's not what he was working on. He's just working on methylation. But what Moshe Szyf is saying here is, hey, that methylation is a type of poisoning. And that type of poisoning, even without changing the sequence of the DNA, can have long-range implications. Let's read that quote one more time. The realization, be nice if the FDA realized it, the realization, be nice if the psychiatrist realized it, the realization that long-range damage could be caused without changing the DNA sequence. Changing the DNA sequence would be a mutation. The realization that long-range damage could be changed without changing the DNA sequence has important implications on the way we assess the safety of chemicals, drugs, and food, and broadens the scope of definition of toxic agents. It's crystal clear. So right there in that little section of the citizens petition, okay, you see all five articles listed. Okay, Nielsen, Shorbov, Walkman, Sandoval, Sierra, and you see the Moshe Szyf article. Okay, the other thing that's listed right here, and I don't want to skip over this. Okay, this is important. Okay, right here I give you, and if you want to call this my opinion, you can call this my opinion. If you want to say this is my interpretation of science, this is my interpretation of science. But what I say right here in this section is right there in front of you, right there on your screen. Okay, I say, hey, because of the studies done by Dell in 1990, Chang in 1990, and then really Kainbaum also in 1998. But originally, I'll just take the Dell study by itself. Because of what we saw in the Dell study, 1990, we saw a malfunctioning in the nervous system. That's what we saw at Dell, 1990. 1990, Dell gave naloxone to opioid-dependent mice. He opened up their bellies, stared at their adrenal glands, and saw that the nerve going to the adrenal gland went haywire. That right there should have prevented further approval of the opioids, at least without a black box warning. Okay, it doesn't get any clearer than that. Okay, the opioids should not have been approved for general use after the Dell study of 1990. And so what I'm saying right here in the citizens petition is, with the Dell study, how did OxyContin get approved in 1995? And if you read real closely right here in the citizens petition, I point out the fact that funding for opioid research changed in 1992. It went from being controlled by NIH, National Institute of Health, and it flipped over to being controlled by NIDA, National Institute of Drug Abuse. National Institute of Drug Abuse is a bunch of psychiatrists, a bunch of mental health people who believe this ridiculous notion of the brain disease model of addiction for opioids with absolutely no proof. They've spent billions of dollars trying to prove it. And in fact, they've ignored real scientific proof. Okay. And I think that's kind of how they got OxyContin approved. Okay. They, in essence, buried the Dell study. They buried the Dell study. They buried the Chang study. Never came up because now everybody's focusing on something called the brain disease model of addiction, which the opioids is a farce. Might be true for alcohol. Might be true for amphetamines. I don't know. Never looked into it. But it's not true for the opioids. Okay. And that's why we go through the citizens petition, not even page by page, but almost paragraph by paragraph, because there is an enormous amount of information packed into this thing. And we're going to break it down and go through it all. And that's what we're going to go over today. Tomorrow, we actually will either tomorrow or the day after, we'll move into a new section, close out the section we're working on now. Please go back to the beginning of the week and listen to these podcasts in order. As you read the citizens petition right there. If you have any questions, reach out to us. We're always here. We'd love to hear from you. Once again, like and subscribe us. Put these podcasts everywhere you can, all over social media. Let's get the word out there. Again, my name is Dr. Doug Smith, and we thank you for your time and for being here today. Thank you.